Recovery from labral surgery is varied, and it kind of depends on what kind of labral surgery you're doing. So let's take just the typical contact athlete that is injured in a football game, that dislocates their shoulder, that has a labral tear. The return to play from that is quite long because they're returning to a fairly violent activity. So you come in, you have your labrum repaired, which can be done arthroscopically. You wake up and you're in a sling. You're going to be in a sling typically for anywhere from between 4 and 6 weeks. You can start some early rehab, but it's pretty limited. But the rehab gets more involved once you're out of the sling. So say 4 to 6 weeks later, you're out of the sling, and now we're starting to mobilize the joint. The first goal of that rehab after that labral repair is to restore your range of motion. After several weeks and recovery of range of motion, then you start to strengthen. That usually doesn't occur until 12 to 16 weeks postoperatively. So first is restore range of motion, then is to strengthen. And that strengthening process occurs over several months. And then in terms of return to play for a contact athlete after a labral repair, it's probably close to 5 to 6 months depending on the amount of labrum involved that was repaired at the initial operation. Now, other labral operations, such as a slap repair or a repair of the superior labrum, say you have a pitcher that has a superior labral tear, and you repair that superior labrum, that return to play is much longer, especially for a high-level pitcher or a volleyball athlete or a tennis player. And that's typically more like a year-long recovery. It's a very violent action to swing your arm overhead and throw a baseball with high velocity. And so that recovery in terms of return to pitching on the mound at pre-injury level is probably closer to 12 to 16 months.